Thank you very much indeed, Pedro Vargas.
For medicine shortages, European health sovereignty, and the ethical lines of AI, Euronews Health Summit in Brussels sparked a flurry of debate. Here are some of the main takeaways from the event, which gathered some of the world's top political and business leaders in health.
We continue to face many challenges: conflict, displacement, poverty and inequality, non-communicable diseases and mental health conditions, antimicrobial resistance, climate change, and epidemics and pandemics. None of these dangers can be managed in isolation. Shared threats demand a shared response.
I think the lesson from COVID-19 is that protectionism doesn't work. And even if we were in Europe, even if we were in a single market, we know that there was a period of time where there were very strong protectionist temptations within Europe. And luckily, there was awareness and people realized that this was not the way forward.
So when we look at AI in health, or AI in general, when you look at the United States, it's primarily funded by the private sector, venture capital.
Yes.
When you look at China, the other big powerhouse, it's mainly state-driven. I think this is actually the biggest opportunity for Europe, which is to be right in the middle, to bring together the public and the private sector to work together. If Europe is able to find that solution, and I think it's critical that the European institutions understand that they need to work closer with the private sector, that the regulators need to create a pathway of conversation with companies developing the innovations from the start, from the moment they start developing the technology all the way to access to market.
We have faced challenges imposed by the pandemic, but we have also taken a very important lesson, which is that health is a strategic asset for Europe. And having said that, what I mean is, if health systems are in trouble, everything else collapses, the societies are suffering, everything else is suffering. So I would say that it doesn't really matter where are the different competencies levels. It matters what kind of health care delivery will be reaching the patients.